a pro at this part. Okay, 5, 4. I broke out a new.
Finish the counting.
No, that's how you do it. That's how you do it. You go 5, 4, and then in your head you're supposed to go.
That's not how you do it. You finish it. 3, 2, 1, go. That's how countdowns work.
I thought it was kind of like you kept, and then we just knew. Anyway, I put on a new sweatshirt.
Nice.
I'm really excited. I've changed shirts, so that's good.
You didn't change shirts. You had the same shirt on underneath it. I could tell.
I do.
Yeah.
But I put on a sweatshirt over top of it, which.
It's all right. I've been wearing this shirt for 3 days.
Me too, but
it's fine.
But we're here with Adrian Shanker. You're the founder, and I'm gonna mess this all up. But you're one of the founders or a founder of the Bradbury-Sullivan LGBT Community Center, correct?
Yes.
And if you could say that better than what I just did.
Sure. I'm the executive director of Bradbury-Sullivan LGBT Community Center. We're in Allentown, and we provide arts, health, and youth programs for the LGBT community throughout the Lehigh Valley.
Cool.
And it's great to be here with you.
No, yeah, thank you. How have you been in your little neck of the woods for the past 32 days?
Well, certainly, this situation is challenging for all of us, and there's really no one that is, I don't think, experiencing this moment in time without experiencing challenges in their lives. For LGBT people, the LGBT community has unique risk factors and vulnerabilities for COVID-19 infections because of higher tobacco use, higher incidence of HIV and cancer, and histories of barriers to healthcare and discrimination. So, for example, 1 in 5 LGBT Pennsylvanians don't have a personal doctor, a primary care doctor. So where do we turn if we have symptoms? And we want to get a COVID-19 test. Do people feel like they will be able to receive one in a non-discriminatory manner? So at Bradbury-Sullivan Center, we're operating completely virtually right now, but one of the things we're trying to do is make sure that our community has access to information about how to keep themselves safe, how to keep their friends and family and their community safe, and that we can also advocate for our community with our local hospitals and with the Department of Health when needed to make sure that LGBT people are treated equitably through this very scary time.
Mm-hmm.
Yeah,
sure.
I mean, let's be honest. I hope I don't have to. That I'm not in the position where I have to go to the hospital or anything like that, or nobody in my family does. But I'm also not in a position where I also have to possibly think about other factors that could get in the way of that, as people who are minorities and such. So I'll be honest, when we are all, thinking about ourselves in this time, it is very sobering to think of other people that would have to go through even more hurdles to get the basic stuff.
Right. Anything that could make anything more difficult in a difficult time seems, super counterproductive to making sure everybody's safe, right? So whatever can be done to not let that happen is super important, obviously.
Right. I mean, but that's why the center is there, and that's why you want to make sure that as many people know as possible that they can reach out to you.
Right, and so our goal is health equity, the idea that all people have access to a high quality of health. And even in a time like this one, a very scary time with the global pandemic, we still should have an expectation as a community in the Lehigh Valley, as a broader society, that if you get sick, you'll be treated equitably. You'll be able to access care when you need it, with or without insurance coverage, and regardless of who you are, as a person, that you'll be treated equitably through our healthcare system. Unfortunately, we know that equity is a dream, not a reality. Early studies have already shown that Black and Brown communities are experiencing much worse effects of coronavirus than white people. That's not biological. That's because of social and cultural instances of discrimination, systemic racism, systemic poverty that affects already marginalized communities. We have a feeling that the same thing is true for LGBT people, but LGBT demographic data is not currently being collected with COVID-19 testing to be able to know for sure. What we do know, though, is from 2016 and 2018, we at Bradbury-Sullivan Center partners with the Department of Health to administer the biannual LGBT Health Needs Assessment, which is a statewide survey that actually gives us a baseline of data about LGBT people's health across Pennsylvania. And it's actually the largest project like this in any US state where we have comprehensive LGBT health data. That's how we know that only 1 in 5 LGBT Pennsylvanians have a doctor. So right now we're actually in the middle of administering our 2020 needs assessment. And it's really important that for people that are LGBT identified, within the broad understanding of LGBT identified, and who live in Pennsylvania, that you participate, because it takes 15 minutes and it gives us incredibly useful data to improve health, not right now during COVID-19, but for the future, for pretty much everything from mental health to cancer, HIV, tobacco, substance use, quality of care at our local hospitals and clinics. We use this data, and the state uses the data, hospitals use the data to improve healthcare for the LGBT community. And so we are looking for more people in the Lehigh Valley and across Pennsylvania to participate. And the survey right now goes through April 24th.
Go ahead, Tyler.
Yeah. So, well, two things. If somebody's listening right now that's not currently aware of you or the center, what steps can they go through, and what should they do if, number one, if they feel that they might be sick with COVID-19, or obviously getting involved with you, there's a website and everything. What are some steps they can do to get involved with you?
Yeah, so that's a great question. So first off, Bradbury-Sullivan-Center.org. And the screen is up. So right on our homepage where it says PA LGBTQ Needs Assessment, that has information about how to take the survey. Next to it where it says Census 2020, that's information about participating in the census. And the bottom tab there, Coronavirus 2019, what LGBTQ people need to know. This is a portal of really useful information about programs that our organization's offering, support for the LGBT community in the Lehigh Valley, unique risk factors, mental health supports, information about connecting to testing locally, COVID-19 testing. There's links to a variety of things, including even New York City Department of Health's Guide to Sexual Health during COVID-19. Information for transgender people about knowing your rights if you are renting a property or dealing with employment. Help for people to quit tobacco, because tobacco use leads to a 2.5 times more likely incident of the worst effects of COVID-19. Guidance for people living with HIV, and so much more. So we've tried to create information here, and it's available for the entire community. And it's just Bradbury-Sullivan-Center.org/coronavirus.
Cool. Yeah, and I think it's a brick and mortar place, right? It's a
yeah. So our community center right now we're closed because of social distancing. So our physical community center, well, the services that we provide, we consider them to be essential for our community. They're not essential to be physically open during a global pandemic. So
you had mentioned you had some virtual ones, right?
So we're operating our programs virtually right now. Normally we're open and we're at 522 West Maple Street in downtown Allentown, but right now we're operating virtually. We have 3 youth programs every single day that are virtual, every day for LGBT youth 14 to 21. Then we also have 13 monthly supportive services, of which 10 of them are operating virtually right now. So those are support groups, community groups. Later today, even we have our free LGBT legal clinic is doing a Know Your Rights webinar about employment issues and rental rights during COVID-19, renters' rights during COVID-19. Our medical marijuana enrollment assistance will be operating virtually in May. So we do have a variety of programs that we're offering virtually. And something we just launched this week is a virtual community poetry program where we are providing opportunities for community engagement through poetry, and that's on the center's social media site, on our Facebook page, where people can actually record a clip of them recording their favorite queer poem, and we'll share it on our page and provide opportunities for community conversations.
Yeah.
So on our website, on the events page,
I'm just here. Yeah, I'm right here on the events page right now.
Yeah.
Just looking
So
through.
if underneath the name of the event, if it's blue, it means that it's happening virtually. If it's red, it means it's unfortunately been canceled. Some of the events we couldn't make virtual, but we're doing as much as we can virtually.
And you would somebody that's not a member of your community, maybe has a loved one that is, it's probably advisable to know rights anyway, right? For somebody that's in your life that you can
so our youth program and some of the support groups are close to just that age group or that population of that specific group. So for example, our LGBT cancer group is only for LGBT people who've been affected by cancer. But other programs are open to anyone in the community. And in fact, when we are operating in person, all of our arts and culture programs are open to the entire community. So we welcome straight people, cisgender people, people that don't identify as LGBT but believe in LGBT equity and justice in the world, and who believe that our society is better when we promote diversity and inclusion for all of us. We welcome you, and we hope that you'll join us.
Let's talk a little bit about some of those things that will happen when you are open, because that day is coming, hopefully. Right?
Soon.
We hope.
What are some things that will be going on at the center that people can look forward to?
So we have an amazing queer art gallery. It's the only LGBT-specific art space in the Lehigh Valley that is professionally curated galleries that celebrate queer artists nationally and locally. We are proud to host our Real Queer film series that brings indie and art house documentary films that are not often not often screened in commercial theaters to the Lehigh Valley. We have book talks all the time. Our library events are really vibrant. So authors that are on book tour, as well as intergenerational community conversations around both memoirs and poetry. Those are some of our in-person events, in addition to our 13 monthly supportive services for adults and our everyday youth program for LGBT youth. And
how do you guys stay open, right? How can people help monetarily? And it's how you can rent space right there for events. But
we do offer our space for rentals, although that's not our it's not our funding model. We keep all of our programs free, so that's really important. We really believe that arts and culture support groups, absolutely youth programs, that these are not a luxury for people that can afford to participate. That these are life sustaining programs, and life enriching or life sustaining, right? So it's been our model and our goal to keep these programs free, and we're able to do that. We don't have members, we don't have annual dues. We ask that people who can afford to donate to support the cause that we are working toward, which is a strong and vibrant LGBT community in the Lehigh Valley, that people who have the means can donate to support us, and they can do that as a monthly donor, as a one-time donor. We are grateful for volunteers as well. Businesses, we welcome them to be sponsors of our programs. And for us, every donor and every dollar makes a difference. So whether a donor gives $5 or $500 or $5,000 or more, we welcome donors of all sizes to support our work. I do want to be clear, though, our programs are available for everyone in the community, regardless of financial means to participate. And I think that we should all desire to live in a community where art and culture is available for free, because it makes our community great and a place where we all might want to live. But we should also desire to live in a community where those who can give back, those who are able to support us do so. And we try very hard to be responsible stewards of our donors' resources and make sure that we're providing programs that our community can be proud of.
Okay, yeah, that's great. That's great. So
no, it's something too. Like when you're talking about the youth programs, do you have an outreach program for kids who are, maybe asking questions, or they want to, talk to somebody. I would imagine that would be something that's important.
Yeah, so with schools closed right now in Pennsylvania, it's incredibly challenging, again, for all youth, for their parents, for their teachers, for the schools themselves. We know that. But for LGBT youth, this is traumatic. Many LGBT youth are out at school to their friends, so that they've come out as LGBT to their friends, maybe their teachers, but maybe they're not out at home. And now they're kind of at home without their peer support. Many of them participated in gay straight alliances in their school, and they don't have access to that right now. So we're operating virtual programs to try to keep LGBT youth connected and supported when we're open. So normally we operate a program from 3 to 7 p.m. every day, every weekday for LGBT youth. We go out and do outreach in the schools and outside the schools to engage youth and let them know about the programs we offer. It's a youth leadership program, so it's youth-led and adult-supported. It's called Project Silk Lehigh Valley, and it's a partnership program between Bradbury-Sullivan Center and Valley Youth House. So for us, this is an essential program, and right now, as the program's offering virtually, we're trying to keep youth at home, frankly, by keeping them connected during the day, and also make sure that youth don't feel isolated, that they have the support that they need. That's so essential, maybe now more than ever. And we're also trying to make sure that so today we talked to one of our funders about trying to get solar chargers for some of the homeless youth that we do outreach with, because they might have cell phones, but if they don't have a place to plug in, they usually charge their phone at school or at our community center. It's hard for them to participate in our virtual programs if they don't have a solar charger. So we're trying to get those kinds of equipment to the youth that we serve as well. And that's just an example.
Sure.
We do much as we can to support youth in our community.
Yeah, it's like it's not possible to think about all those things that are needed, especially like a cell phone charger, a place to plug it in, something that simple,
right?
That's not available. So
and understand that 40% of homeless youth are LGBT. So 40%, 1 in 4 homeless youth are LGBT. That's vastly greater than the population of LGBT youth. So these youth aren't homeless because of the reasons that other people are homeless. They're homeless or housing insecure because of family rejection, because of familial homophobia or transphobia. We create a safe space for them. And right now that safe space is virtual, and we need to make sure that it's available to them. And it's not just a physically safe space, it's a brave space where LGBT youth can truly be themselves.
Mm-hmm. Yeah. And if somebody, unfortunately, as we see with the schools too, not everybody has access to Zoom or Skype. Do you have any advice or solutions for, kids that need some help to connect?
What if they can only do a phone call?
Yeah, so first off, our youth program staff are available for one-on-one conversations with the youth as well, but we're offering our virtual programs on 3 different technology formats. So we're utilizing Instagram Live, Zoom, and Discord to connect with youth. And if any youth or their parents or teachers are watching this podcast, it's Project Silk Pride on Instagram. So again, Project Silk Pride, SILK. And if they send a direct message to our staff through Project Silk Pride on Instagram, they'll get an immediate response and a schedule of the programs for the youth to participate in. If it's a youth that we haven't interacted with before, our staff will probably find a way to communicate with them first to make sure that they're in the right age group and everything. But the program is available on 3 different formats.
Yeah, well, that's great. And obviously, we commend you for everything you're doing for your community. I'm
just happy. I'm just happy to get the word out. If we can get that information out to, somebody who needed it, that's awesome. And it's awesome that all the information is on the website. We'll link to everything and make sure that we push them to the website so they can get more information, since it's all there.
But yeah, and on a more personal level, how are you personally dealing with?
That's what I asked in the beginning.
I'm doing the best I can, just like all of us are. I think that we'd all be lying to ourselves and to our community if we pretended that we're all doing great right now. I think that, social isolation is challenging, physical distancing is challenging, working from home has tech challenges. We're all doing the best we can, myself included. And I think that one of the most important things that all of us can do right now is to support each other, support the organizations that we care about, that we hope will be reopening after this is over. Check in with our friends, tell them that we care about them. Check in with our family. I do a family Zoom call every weekend to stay connected to my family. I recommend that as a strategy for people, whether it's with your chosen family or your biological family. But to have an opportunity that's structured in your calendar to kind of stay connected to people you love and care about. And so that's one thing that I'm doing to support myself and during this time. Yeah,
for sure. I'm actually impressed of how quickly my grandmother picked up Zoom. I didn't know she had it in there, but she's nailed it. So I guess.
Me too, actually.
Now, and now when you're done, Grandma's gonna be like, "I know how to Zoom you now. I could just because you're not in quarantine, I can still find you."
Yeah.
So, well, hey, Adrian, thank you so much. I know you got a lot of stuff to do. We're gonna get this out as quick as we can, and we'll include all the links. And again, thank you so much.
Thank you both for taking the time to do this and for the work that you're doing to promote information for nonprofits in the region right now.
Of course.
So thank you. Have a great day.
Hey, be safe. Thank you.
You too.